Good evening. I have to say that it's a bit surreal to see all of you here, because I know all of you from lots of different places in Baltimore, and this is Baltimore in the White House. So anyway, it's great to see you all here. Thank you to the Obama administration, the Aspen Institute, Baltimore Core for allowing us to showcase today the Baltimore that we know and love. Let me take you back to 2009. 2009, Baltimore had one of the worst infant mortality rates in the US. Our babies were dying at the same rate as those born in countries in the middle of civil war. A Black infant was 5 times more likely to die than a white infant. This was unacceptable. So our city's health department led a coalition of public and private partners to found a program called Be More for Healthy Babies. Within 6 years of this program, Baltimore's infant mortality has dropped by 28%. The number of babies dying in their sleep reduced by half. And on top of that, the disparity between Black and white infant deaths also dropped by 40%. Now, why did this work? First of all, Be More for Healthy Babies started with a shared value that is indisputable, that we must protect the most vulnerable, our babies. And second, Be More for Healthy Babies had one citywide strategy based on one goal, with one metric that is as objective as it gets, which is looking at infant mortality. So the strategy was set by the city based on data and science, but the delivery was not only by the city. It was by all of our partners in all, over 150 of them, hospitals, clinics, foundations, businesses, sororities, and churches. They participated in teaching the ABCs of safe sleep, delivering cribs, and doing home visits. But whereas before these groups had their own programs in their own silos, now they are aligned to one goal, one evidence-based strategy, one shared outcome: to give babies a chance to achieve their full potential. And it worked. You know, there's a tendency for us to look at the problems that cities like Baltimore face and say, it's just too complicated. There's nothing I can do now. And it is true that the unrest, the uprising that happened last April didn't happen overnight, that there are deep-rooted problems of inequality, poverty, and racism. But our residents feel the fierce urgency of now. They're not expecting a silver bullet, but they're looking for local government to deliver interventions that demonstrate success and restore faith to achieve these longer-term goals. Addiction, huge problem in Baltimore, just like around the country. In our city, there are over 20,000 people who use heroin. More people die from overdose than die from homicide. If this were the rate of Ebola or measles, believe me, that would be a public health emergency. So I declared overdose to be a public health emergency. We passed legislation so that as of October 1st, 2015, I became the single prescriber of the opioid antidote, naloxone or Narcan, to all 620,000 residents of our city. We believe that every resident can save a life, so we began doing trainings all across our city. We partnered with businesses, community groups, and faith leaders to provide trainings in markets, churches, senior housing, jails, bars and restaurants, even the zoo. My staff say that soon we'll be in every McDonald's. Would you like naloxone with that? Since 2015, we've trained over 11,000 people on how to save a life, which includes the police. And so in just 8 months, they have saved the lives of over 30 of our residents. And I believe this is the power of taking action now. The health department, we realize that we can't solve problems alone, but we can lead interventions and convene other partners around the strategy. Take violence prevention, certainly not something that the health department can take on alone. But we run a program called Safe Streets, where we partner with community-based organizations like Living Classrooms, Catholic Charities, to hire recently released citizens, many of whom were former gang members and drug dealers. These workers walk the streets of Baltimore and they interrupt violence where they see them. Last year, 2015, they mediated nearly 700 conflicts. The majority of those conflicts were later deemed to be likely or very likely to result in gun violence. So how many lives did they save? And how many others did they impact? Well, here's another program that we see in public health as a violence prevention initiative. It's pretty easy to understand that if kids can't see, they can't learn. Well, we found a barrier, which is that children were only getting eye exams in their schools in pre-K, first grade, and 8th grade. Well, how many of you who wear glasses, or I wear contacts, but how many of you got your vision problems detected between 1st and 8th grade? Probably a lot of you. And on top of that, we found that less than 20% of kids who screened positive were getting glasses because of transportation or cost, because the fashion wasn't cool, or something else. But that means that thousands of our children can't learn, can't read, and may be labeled as being disruptive, may be held back in school, then get involved in gangs, and end up in trouble, when all they needed at the very beginning was the simple intervention of glasses. So last month, together with our partners, Ron Daniels at Johns Hopkins University, with the support of our local foundations like ABLE and Casey and Strauss, we launched a program to provide eye screenings for every child in every grade, K through 8, in Baltimore. And for all kids who need them, we will get them glasses free of charge right in their schools so that they don't have to miss school and so their parents don't have to miss work. This program, we call it Vision for Baltimore. By the way, other names that were top contenders included Glasses Half Full, Sight for Sore Eyes. Now, I won't say which of our health department staff came up with those ideas, but they are here today. And they may or may not be related to Baltimore Core. Now, this is the necessary role of local government: to go to where people are, to bring the community together, and to respond to our resident needs. And here in Baltimore, we go one step further, and I'm fortunate to work under a very transformative mayor, Mayor Rawlings Blake, and we look forward to doing this under our next mayor as well. But I want to end today with a quote from one of our elected leaders, one of my heroes, Congressman Elijah Cummings. He says that it's not enough to look for common ground. We need to aim for a higher ground. So we don't think of health as the absence of disease. We aspire to create well-being and ensure that everyone can reach their full potential. We don't see our youth as problems to deal with. We aspire to have them be solutions to every problem. We don't want local government to meet expectations. We aspire to show how local government can bring together civil society and all of our partners to be that transformative leader to create vision and inspire courage. Why can't local government function with a startup mentality to catalyze social innovation and citywide change? Finally, we don't want Baltimore to be as good as other cities. We aspire for Baltimore to be the model, the bright spot that others look to around the country and the world. We are doing that now. Thank you for the opportunity to share our work.